Did you know that the secret to looking younger isn't just in your skincare routine? Imagine erasing wrinkles, plumping up your lips, and rejuvenating your skin, all without surgery. Intrigued? You're in the right place.
Now, in the realm of aesthetic medicine, several treatments have gained popularity for their ability to enhance facial features, reduce the signs of aging, and improve skin quality. Among these, Botox, dermal fillers, microneedling, and PDO threads. I will be talking about each of these treatments individually. Let's dive in. Number 1, Botox. What is Botox and what does it do? Now, let's start with one of the most popular topics in the world of aesthetics. Botox, or botulinum toxin, is a purified protein that is injected into specific muscles to temporarily reduce the appearance of wrinkles and fine lines. It was first discovered in the late 1800s, but it wasn't until the 1980s that its cosmetic applications were explored. Since then, Botox has become increasingly safe and effective thanks to the ongoing research and advancements in the field. Botox is a brand name for the botulinum toxin and is a neurotoxin used to temporarily paralyze muscles and is primarily used to reduce the facial wrinkles like in the forehead, between the eyebrows, and around the eyes, the crow's feet. Botox works by blocking the nerve signals to the muscles, preventing them from contracting and thus smoothing out wrinkles. There are many brands of the botulinum toxin that are FDA approved that are available to use, such as Dysport and Xeomin, not only the Botox brand. Now, the effects of Botox typically last between 3 to 6 months. You would need a refill most of the time to stay there. The duration can vary depending on the individual's metabolism and the area treated. The pros are that Botox is a non-surgical treatment with minimal downtime, and it can effectively reduce the appearance of wrinkles and prevent new ones from forming. The cons are the potential side effects that include bruising, swelling, and in rare cases, drooping of the eyelid or the eyebrow if the toxin spreads beyond the treatment area. There are other complications, because while Botox is generally safe, it can lead to other complications if injected improperly. This may include asymmetry, unintended muscle paralysis, and in rare cases, systemic effects. Number 2, dermal fillers to the face. What are they? Dermal fillers are injectable substances used to restore volume and smooth out wrinkles and enhance facial contouring. Commonly made from hyaluronic acid, and these fillers can address areas such as the cheeks, the jawline, and the nasolabial folds. The longevity of the dermal fillers varies depending on the type of filler used, the area treated, and the individual's metabolism. Most hyaluronic acid fillers last between 6 months to 2 years. The pros are that dermal fillers provide immediate results and can be used to achieve a more youthful appearance. And then the cons are the potential side effects, which are minimal, but they are redness, swelling, bruising at the injection site, and then the more serious complications are, though rare, that include infection and vascular occlusion. Improper injection techniques can lead to the complications such as lumps, asymmetry, and in rare cases, necrosis of the skin. We don't want that. Number 3, dermal fillers to the lips. Lip fillers, a subset of dermal fillers, are specifically designed to enhance the volume, shape, and symmetry of the lips. They are primarily composed of hyaluronic acid, and the duration of it are that they typically last between 6 months to a year, depending on the type of filler used, and also the individual's response. The pros are that lip fillers can create a fuller, more defined lips and improve lip symmetry. The cons are the common side effects that include swelling, bruising, and tenderness at the injection site. There's also a risk of uneven results if not done correctly. Complications from lip fillers can include granulomas, infection, and in rare cases, vascular compromise, leading to tissue loss if the filler is injected into the blood vessel. 4, microneedling. What is microneedling and what does it do? Microneedling is a cosmetic procedure that involves creating tiny punctures in the skin using fine needles. This process stimulates the body's natural wound healing response, promoting collagen and elastin production. It is used to improve skin texture, reduce scars, and minimize fine lines. The effects of microneedling are not immediate and typically require multiple sessions for optimal results. The improvements in skin quality can last for several months depending on the individual's skin condition and maintenance treatments. The pros and cons of microneedling are: the pros are that it is minimally invasive and can be used on all skin types. The cons: common side effects like redness, swelling, and bruising. And there's also the risk of infection if the procedure is not performed under sterile conditions because it is still a needle. The complications of improper technique or lack of sterility can lead to complications such as infection, scarring, and pigment changes. Number 5, PDO threads. What are these? PDO threads are absorbable threads used in a non-surgical procedure to lift and tightening sagging skin. They are inserted under the skin to provide immediate lifting and stimulate collagen production over time. The lifting effect of the PDO threads is immediate, with further improvements seen in collagen production over time, and the collagen increases. The threads dissolve over 6 months, but the collagen induces lifting can last up to 2 years. The pros of the PDO threads are that it's a non-surgical alternative to facelifts with minimal downtime. The cons: potential side effects like always, like swelling, bruising, and discomfort. And there's also a risk of thread migration or extrusion if not placed correctly. Complications can include infection, nerve damage, and asymmetry. Proper technique and aftercare are crucial to minimize these risks. Aesthetic treatments like Botox, dermal fillers, microneedling, and PDO threads offer various options for facial rejuvenation. Each treatment has its unique benefits and potential risks, thus emphasizing the importance of seeking services from a qualified and experienced professional. Who can inject these things? Who can do these procedures? Now, all these procedures should be administered by a licensed medical professional, and those include plastic surgeons, dermatologists, certified physicians, dentists, nurse practitioners, and also registered nurses under the supervision of a physician. It is crucial to choose a provider with appropriate training and certification to ensure the safety and efficacy. Safety is always our top priority when it comes to any medical procedure or treatment. Throughout this channel, we'll be discussing the importance of seeking qualified professionals and following proper protocols to ensure the best possible outcomes. Unfortunately, not all aesthetic procedures go as planned. We'll be taking a closer look at some botched procedures and discussing what went wrong, as well as exploring the latest celebrity aesthetic trends. In addition to aesthetics, we'll also be covering important topics relating to medical education and overall wellness. From weight loss strategies to nutrition and healthy lifestyle choices and all the chronic medical conditions out there, we'll provide you with valuable information to help you achieve your goals. Make sure to follow Miranda Beauty and Wellness channel. So whether you're interested in learning about facial aesthetics, weight loss, or overall wellness, be sure to follow us, and we'll be your trusted source for accurate and up-to-date information delivered in an engaging and entertaining way. Stay tuned for our next episode, where we'll be diving deeper into the world of aesthetics and explore its many applications. Until then, take care, and remember, beauty and wellness start from within.